When you hear the word facelift, do you picture a frozen expression? It's time to retire that outdated image. Today's modern facelift isn't about pulling just skin, it's about restoring the architecture beneath it. Today, we're cutting through the social media filters and the hype to give you the hard facts about facial rejuvenation. We'll explain why tight is out and refreshed is in, and how the right surgical technique can turn back the clock by a decade or more. Stick around, you won't want to miss this.
Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evan Zug, also known as The Doc Dudes.
Welcome to The Doc Dudes. I am Dr. Garrett Harper, joined by
Dr. Evan Zug.
Nice. It's like, we got that. Both board-certified plastic surgeons. Today we are tackling one of the most requested, if not the most requested topics, yet also one of the most misunderstood topics at our practice, the facelift. Okay? We are going to discuss what it can do, what it can't do, and why your anatomy matters more than your age, right? So, Evan, talk to us about kind of what a facelift when somebody says, I want a facelift. What do they mean? What are they telling you? What are they asking? What do they point out to you that bothers them?
Yeah, so a facelift, most patients want to look like themselves, but 10 or 15 years younger. They don't want to look different.
I do too.
Every once in a while you have a patient who really wants to change how they look.
Yeah.
And that's difficult.
Yeah.
But most patients just want to look more refreshed and 10, 15 years younger.
Yeah, so you got to
I like to look at pictures of patients when they were younger. I'm like, hey, can I see some pictures of you 10 years ago?
Yeah. And then one thing to think about is you got to try to teach the patient what happens to the face. Like, how does a face age? Like, what are the different kind of things that happen as someone ages, Evan?
So you have more loss of elasticity in your skin. So
Sure.
your skin has some laxity to it.
Yep.
The muscles also become ptotic or drooping.
Yeah.
So not as tight as they were. You have fat compartments in your face, and so you lose fat in your face as you age.
Yeah. And I think
the bones.
Yeah. So that's a huge point, right? Like the joke in plastic surgery, or a joke in plastic surgery, what I tell people is, if you don't ever want to have a facelift, starting at the age of 40, just gain 5 pounds every year, right? You'll be like William Shatner. Mm-hmm. William Shatner's probably 80 years old, and that dude still looks like he's 30 because he's just kind of a little chunkier now. And so because we lose volume in our face. And I actually think it was kind of neat. What showed us that, what proved that to us, what got plastic surgeons thinking was there was a study, a CT scan study, MRI study, both of those modalities on epileptic patients, right? These are patients that have seizures. And so they started out when they were young, and every 5 years or so, they'd have them come in, and they were doing this really long, like 30-year study on these patients, and they would image them through CT or MR. And then they would, finally, we got to the point with the technology that you could actually measure volume in things, right? And so we took those patients as plastic surgeons and we said, hey, we'd love to look at your patient cohort and follow them and look at fat volume in the face, muscle volume in the face, and what's happening. And what we found out was you were losing it. Mm-hmm. And so a lot of times, eyelids were a great kind of change in our understanding and the way we approach things. Was you used to look at some of the bags underneath people's eyes and you say, oh my gosh, look at all that fat in their lower eyelid. We got to take that out. And these docs 20 years ago would just skeletonize and just remove all of this lower eyelid fat bags. And then they look like cadavers. They looked older, in fact. And so what we realized was, well, it's not like there's an increase in volume of fat in the lower eyelids. the bags that are holding that fat are just getting looser and looser and looser. So we need to tighten those up. And so we addressed it differently and address it differently now than we did 20 years ago. And I think patients are getting much better results because they're not, walking around looking like they're a skeleton, which is what they were looking like. So we know skin obviously changes, unfortunately, everywhere, not just our face, but our whole body. As we get older, we lose that elasticity like you talked about. There's plenty of ways that our estheticians can help delay that, minimize that as best we can. But when we see patients, right, it's part of the best thing about being at a practice that can address people at every stage in their aging. The estheticians are sending them to them because they're like, look, nothing's going to help. Nothing that I can do is help. This patient fundamentally has a change in their skin, has a change in their muscle position, and has a change in the volume in their face as far as like fat and those types of areas. And so that's where we can, optimize patients' skin as well as we can prior to surgery, which we do for every facelift patient that we have. We can restore their musculature, right, of their face. And there's multiple techniques to do that. There's multiple ways to address that. Everybody on social media thinks that they have the best way, right? But we have...
I'm sure we'll get into that.
We have tons of studies that show that there is not one perfect way. It's really what's best in the hands of the doctor that you've chosen, right? And so there are different techniques with that. And then there's volume restoration, which you and I can do with fat grafting, which is a great advent to use along with a facial rejuvenation procedure. But we also have some amazing nurse injectors that can do it and restore volume through the use of hyaluronic acid fillers or Sculpture or some of these other kind of injectables that will also restore volume to the face, which is great. And so let's talk a little bit, right? Because what's wild is there's so many articles that are in Vogue or in New York Times or Wall Street Journal or all these things about these plastic surgeons. Because, you've heard me trying to figure out why this is happening. But plastic surgeons that are charging $150,000, $200,000, $250,000 for a facelift. What do those doctors know different about the anatomy of the face or the technique that they're using that the rest of plastic surgeons don't know that's allowing them to charge this much for a facelift? Because I don't know anybody in this city that does that. Do they have a special stitch? Do they have a special technique? Why are they able to command that type of money?
And let's be honest, we're performing elective cosmetic surgery for patients. So they want to go to someone who they think is going to give them the best result. And that leads to plastic surgeons marketing things with special names. Yeah. The California facelift or whatever. Yeah. And it a lot of it is a marketing thing. Right. You still want to go to a surgeon who does a lot of facelifts and has really good results that they can show you. But as far as going to someone because they do the California facelift is probably not the best way to make a decision. Yeah. Yeah, I'm absolutely dumbfounded by it sometimes. I do think that sometimes it's a status symbol for people that in their little group of friends, they can tell somebody that they went to Dr. Smorgasborg and they know that they obviously have enough money to spend, $150,000, $200,000. But I learned facelift by some incredible people in Atlanta. And then, Bob Graper, who I've been in practice with for over 10 years, that guy trained in Dallas, which used to be the facelift capital of the world, right? And I was at Emory, which had a bunch of huge names in there. You've trained at UAB that has another whole set of guys.
Jim
Grafting taught me how to do facelifts.
And so I remember coming down with Bob Graper and I'd go watch him do facelifts when I was starting out. And I just asked him all these questions well, what about this? Yeah, did you ever try doing this deep plane facelift or like the super deep or the ultra deep or like all these different kind of iterations that you hear about? And he's like, I've done all of them. He's like, the safest, most reliable way is the one that I kind of do now. And so, I've taken his kind of philosophy on addressing bone and muscle, right? Putting that in the proper place that it's supposed to be, restoring it in the direction that it falls, right? Putting it back where it used to be, and then redraping the skin over that. And how it's always so much better to limit your dissection before you get into problem areas or release things you don't want to release or pull tighter than you need to pull, because it's very hard to go back and correct some of the problems that I think we see with the California facelift, or what I would consider the California facelift. I used to always think, like, how can these rich celebrities who have all the money in the world get such terrible results? And I think they were just in the wrong hands. I think that they just went to maybe surgeons that marketed better, or were just kind of, more in that scene instead of going to, people who were tried and true. I mean, there was a guy up in Raleigh up until a couple of years ago who was really well known for being an amazing facelift guy, and people went to him and they all looked rested, they all looked improved, but nobody had that operated on look. And you were like, oh my gosh, like, what's he doing? Well, he's just keeping it simple, stupid. Mm-hmm. He's being smart. He's basically putting things back where they were in the direction that they've fallen. And so it's not rocket science, right? But when people talk about a deep plane facelift, right? Because that's a buzzword out there. What's a deep plane facelift?
Yeah, so when you're doing a deep plane facelift, it's described as going underneath the SMAS, or the superficial muscular aponeurotic system, basically the fascia of the face.
Yeah.
Going under there and tightening the SMAS from underside.
Yeah.
The underside of it, instead of plicating, basically folding it on top of each other on the outside of it.
Right. So one kind of pulls that connective tissue layer and skin together. And like, I think the more traditional technique, the way I kind of looked at it was, sometimes I look at creating the defect. We used to talk about that all the time in plastic surgery and other arenas. And it was like, let's kind of separate this into components. And so the deep plane facelift, you're dissecting right over the facial nerves, right? And so you can be super close to those nerves. And obviously in the right hands, that's not going to be a problem. But we see plenty of examples. You can look at television. There was a particular newscaster that was on Fox News for a long, long time that, she had facial nerve injury after she had a facelift by a guy in Washington, D.C. And I know that whole story. And it's like, that guy does thousands of them. So it's like, there were more risks involved with a deep plane facelift. I also think it was one of these things where people who were doing them maybe used that as a marketing tool themselves by saying, like, look, this is a riskier procedure. You want somebody who does thousands of these, and like, don't go to somebody who doesn't use it. And all of a sudden, because it was riskier, it was better.
But when we plicate the muscle or the SMAS, that is essentially a deep plane facelift.
It's moving those tissues back where they're supposed to.
But you're avoiding the risk.
Without dissecting.
And you're having a quicker recovery because you're going to have less swelling.
Right. 100%, which is why I think, after being, with Bob Graper and seeing the beautiful work that he did for years and years and years, and realizing that his technique had evolved, right? And so he learned the deep plane facelift by the dudes in Dallas. We're talking Sam Hamra and a bunch of guys in Dallas that came up with, what were at the time revolutionary steps in facial rejuvenation. He's tried all those. He did all those for a while.
And so the other example that I'll tell you is Dr. Grafting, who trained me how to do facelifts.
Yeah.
He does a SMAS plication, but he does all of these other pretty aggressive deep neck shaving the submandibular gland, addressing the digastric muscles, doing hemostatic nets. We can talk about that if we want to, but lots of really things in a facelift that are evolving and newer and newer, but he still does application. So what does that tell you?
Right. I mean, it tells me that the people who have done this for a long time and have successful practices, that those are the people that I want to emulate. And those are the techniques that I think are more tried and true because they've got 30, 40 years of doing this and seeing what the results end up being. I mean, I remember they did twin sister studies, the folks at Manhattan Eye, Ear, Nose, and Throat with Cheryl Aston and those guys. And they took identical twins and they did different techniques. And then they'd come back at 5 years, 10 years, 15 years and say which one was which one held up better, which one was the superior result. And there was no difference. And so it was like, if you can just kind of eliminate some of the risk and do a safe procedure and restore patients back instead of just kind of cranking and pulling, I think you're going to have a lot happier patients, And then afterwards, what I tell patients is it's always, you got to protect the investment. It's all about skincare regimen. It's all about adjunctive procedures as far as lasers, radiofrequency microneedling, adding that to your armamentarium in the future so that you can maintain your results better and do that kind of stuff, right?
And the reason we're talking about this is because all the time we have patients who call the front desk or come see us and say, hey, I want a deep plane facelift.
Yeah, right.
So you are explaining this so that people can understand that it's
just because you saw it in an Instagram
more about the
video.
Surgeon.
That's 100%.
More about the surgeon.
Yep, that's 100%. What's a mini facelift? Like, what does that mean?
Yeah, so a mini, I mean, it means different things to different surgeons for sure.
Right.
A lot of times it's really the incision in front of the ear and not going back into the hairline.
Yeah.
And it's basically a smaller incision.
Yeah, less dissection.
Yeah, quicker recovery.
And some people tell you, it's from your incision you dissect out 4 to 5 centimeters instead of meeting in the middle, which is what kind of a true facelift, neck lift does, and that kind of things. Okay, so somebody that's looking at themselves in the mirror right now while they're listening to our podcast, and they're like, I just don't know. Am I a candidate for this? Like, do I need to start thinking about a facelift, neck lift? What are the signs that, hey, you're probably a great candidate? This is something you need to think of. Not just like, I don't like my neck. I don't like my neck, but I'm not a facelift neck lift candidate right now. I probably should do some Morpheus radiofrequency microneedling and stuff like that. Or maybe I should just, lose 5 pounds. But talk to me about like, what are they seeing in the mirror that you could tell them, you know what, it's time to see the doc?
Yeah. So typically the lower 2/3 of the face are going to be in the neck are going to be affected with the face and neck lift. So if someone has some jowling, if they have some extra skin under their neck, if they have some loss in volume and, the cheek area, all those things are going to be addressed with a face and neck lift.
Okay. And then, people will always grab on like the lower to the side of their chin. They'll grab these things and they'll be like, I don't like these. And they're jowls is what we call them, right? And it's just basically muscular descent. It can be submandibular gland in some patients that just have like kind of, which are glands that basically help saliva the floor of your mouth. So that was kind of a cool thing to do sometimes where people were like, cutting them and sealing them off and doing stuff like that. You could get dry mouth. You could also get some leakage and you could get sialoceles, which was not a great thing. So I don't mess around with the submandibular glands. If God gave you submandibular glands that are just a little bigger than you want, they were probably always like that. And so let's kind of restore you. There's obviously some tricks that we can do to the jawline to help kind of blend that in more. But I am not a proponent of cutting out submandibular glands or
there's
going
just
in there
some
and causing
significant
problems.
risks to it.
Yep. What about somebody that's looking in the mirror and they say like, geez, I don't like these things, but I'm only 40 years old. I'm too young for a facelift. Or contrary, they're like 70 years old and they're like, I don't like these things, but I'm 70. I ought to just kind of accept it. What do you tell those patients? Like, is there an age for a facelift?
The trend, one of the trends in our field right now is patients are having procedures, especially facelifts, younger and younger.
Yeah.
Before they get to 60 and they're like, okay, obviously I need a facelift now.
Right.
But yeah, I mean, it's kind of the trend right now. And there are, ways that we can help with that.
Yeah.
And it is less of a surgery.
Yeah, so it's going to be less that they potentially probably need, and it's going to be something where once we kind of get them back and we get in a maintenance program to help with their skin, to help with their volume, to help with these things that are going to continue, maybe they don't need another one, or maybe they need a smaller procedure down the road. But I always tell patients, I'm like, if you're 40 and you don't like it, you want to go around 20 years not liking the way you look just because you are only 40 and you don't think that like this is when somebody gets a procedure done. So, I encourage patients, I'm like, I don't want you to wake up or go to sleep or every time you look in a mirror or you're not looking in a mirror because you don't like the way you look, or you're, doing Zoom calls and you're always like video off. Like, come on, I want to see your face. Like, let's chat. Let's do it. Like you lose that kind of human connection. So I'm like, just get it done. I remember, Fouad Nahi is one of the leading plastic surgeons in the country. I absolutely love him, mentor of mine at Emory. And this was good advice for him. He said, when you're starting out, the first five facelifts that you do, you want to do them on people that don't need them. I was like, that's pretty great. But his point was, you want to do younger patients because they're going to be able to, they're going to have better quality tissues and they're not going to need as much done. The dissection is the same no matter what you do, right? The principles of the surgery are the same. The steps of the surgery are the same. But boy, isn't it great to have somebody that like just needs a little bit of improvement and you can really nail it than somebody who like comes to you and should have had something done a long, long time ago. That's a different animal. And people just need to realize that like the trend, and I hate trends. So another way to phrase that, the modern thinking is that the earlier you're adopting some of these technologies and the earlier you're going into these surgeries, the easier it's going to be to maintain a really beautiful, youthful look. And so I 100% agree with that, right?
Great way to put it, and I feel the same way.
Yeah. And so talk to us a little bit just kind of about recovery after a facelift, neck lift. Like what are patients to expect in the first couple of weeks?
Yeah, so that first week after your facelift, there's a lot of swelling and bruising, and you're in a head wrap, and I'm not letting you move your neck from side to side at all, sleeping elevated. By that second week, you're going to see a big difference in the swelling and the bruising. And by that third week, I mean, you're really able to go out and do things, and people aren't going to quite notice. The scars are still a little bit more visible at that point, but a lot of the healing is gone away, and that's just because the face is so vascular and heals so much quicker.
Yeah, and I tell patients, it's like I remember even when I started out, we put a drain. Every single patient had one drain, and we took it out the next day, typically. And then the advent of these tissue glues has really changed that. Like we don't need to use drains anymore, which is super awesome. Now patients still go home, they're in a head wrap. We actually put a towel around their neck and tie the towel on the front and have them facing forward because we don't want a lot of movement of the neck. We don't want any shearing forces while everything is trying to sit down and heal. So for the first week, you're looking straight forward. You're sleeping in an upright position, which can suck, right? Like, no doubt about it. But, once we make sure everything looks great at your 1 week appointment, you can start moving your neck kind of 45 degrees to each side. And after looking straight ahead for a week, you feel like you're an owl and you're just like turning it on its, all the way around basically. And then after 2 weeks, you have full mobility.
Yeah.
And you can go out, especially with certain hairstyles that kind of cover your incisions. But, incisions are going to take up to a year to fully mature. And we're going to keep them moisturized in that first several weeks. And then we're going to switch to a scar gel that's going to help expedite that. You can go back to using your skincare and gentle face washes and things like that. A lot of times, right, we're combining facial rejuvenation with eyelid rejuvenation or a brow lift or anything like that, or lip lifts or any of that, even some resurfacing that we can do with lasers and peels at the same time. So there's a whole bunch of adjunctive things that we can do with facelifts and neck lifts. And sometimes it's important depending upon what technique's being used and the extent of the other adjunctive procedures you need, sometimes it's great to separate those, right? What you don't want to do is stress the skin too much to where we start having issues with healing or anything like that. So you got to be very mindful of those things. But, I will say, we had a special for a while, a couple of months back, that was alaclay, which is like cadaver fat, right? And now they're developing one for face, dermaclay, right? Which it's kind of coming out. It's one of those things where it's new to the game, but it's processed a little bit differently, and so it should be able to be received by the facial structures better than the buttock or something like that, wherever kind of alaclay. Alaclay was great for the body, and dermaclay is going to be for the face. So, that's another kind of adjunctive thing that we can use, because by improving the take of these fat grafts, I feel a heck of a lot better about adding that as part of our plan for facial rejuvenation, right? I mean, that's
I like to do a lot of fat grafting with the face to address the temples, the cheeks, some little areas. The problem with fat grafting is, 70-80% of it survives, and so you lose a little bit of that volume.
100%.
And so that's the kind of the exciting thing about dermaclay, which is not out yet, but it behaves a little bit differently than fat, and also behaves differently than an HA filler. But I kind of equate it more to like a natural filler.
Sure.
That's how I kind of think about it.
That's what the body had there, right?
Rather than fat.
You've got fat pads in these areas, and so restoring like for like is a fundamental principle of plastic surgery. So I think being able to use that, and then also use our nurse injectors to help kind of highlight some areas of your body that and of your face that will improve with things like Botox. Like using Botox for chemical brow lifts have really reduced the needs for a lot of the brow lifts that we see. And we do way fewer brow lifts than we used to 15 years ago, because it's just not as necessary as it once was. But all right, so to summate this whole thing, right, to like kind of come in, we started off by talking about $150,000, $250,000 facelifts, and how if it really is important to you to be able to tell your friends and prove to them that you can spend that much money for a facelift, have at it. But that there's tons of really great plastic surgeons and facial plastic surgeons that know the anatomy just as well, have read up on all the techniques, have tried all the different techniques, know what's best in their hands. And I think that's one of the most critical things. Like, listen to your surgeon. If your surgeon tells you he or she wants to do something a certain way, it's because besides you, they want you to have the prettiest result possible. And so in their hands, that's what they're going to recommend for you, because it's not like it's not like some of these techniques are only known to a select few, right? We were all taught all these.
Right.
It's just minimizing risk and still getting the best result you possibly can. So, don't go around chasing trends or listening to buzzwords and finding somebody, and that's in any plastic surgery, right? You want to make sure you go to somebody that you completely trust, that you think does beautiful work, that has a great reputation and feels comfortable offering you a particular surgical procedure. And if they don't feel comfortable with it, then respect the heck out of that person and listen to them and understand why.
We have things that we would recommend going to see one of our colleagues in the city for. And
100%.
I have said that before to patients. I'm not going to do something if I don't think I'm going to give you the best result for it.
That's exactly right.
Rhinoplastics, for example.
Yeah, absolutely. Yeah, you got to feel, you have to be comfortable as a surgeon offering these techniques and these procedures to people. And, the worst thing is for plastic surgeons to change what they offer for patients based on buzzwords or trends or things like that. Yep. I think that's when you're going to start getting into critical problems. And then that's when the whole kind of plastic surgery lure diminishes.
Yeah. And the social media is a double-edged sword. I mean, I encourage patients, and I try to do it in a way that is not marketing or advertising, but essentially it is marketing and advertising. That's what social media is for patients, especially now. That's how they do their research. So I've kind of branded mine in a way, and we have as a practice to educate patients and show them our before and after results, and also have a little bit of fun. But for patients, just need to really understand the goal of social media and why we do that, and to try to stay away from some of these trending things, or, there's all of these filters that some surgeons will use. And there's just, you got to trust your surgeon and vet your surgeon.
There's all sorts of stuff, right?
Yeah.
Like, so I 100% agree, and so, if you as a patient are noticing signs of aging and want to know if a facelift or even a non-surgical plan is right for you, call to schedule a comprehensive consultation. We always have estheticians, nurse injectors, and laser specialists and plastic surgeons here. There's always somebody available. And so, if we, it's the best part of a practice like this, that we can get you in the hands of the person that can get you to your goals the safest and the best. But we'll take a look at your anatomy, create a plan that's uniquely yours. Visit ghsurgery.com or call us at 704-375-7111 to schedule a consultation with either one of the plastic surgeons here, or start home base estheticians. Start with them, see what the skincare specialist can do, and then they can kind of graduate you to different levels, and that way we can optimize your result the best we can, right? Your voice matters to us. If this episode sparked a question, or if you have a topic suggestion for a future episode of the Doc Dudes, don't hold back. You can easily reach us through ghsurgery.com. Just click the dedicated Doc Dudes link on the homepage to submit your input and questions. Make sure you're subscribed so we pop up automatically. We drop fresh episodes on the last Tuesday of every month. Find us wherever you listen, either Apple Podcasts, Spotify, iHeartRadio, YouTube Music, and more, and even right on our website. Finally, keep up with everything happening in our practice, which is a lot, and get episode updates by following our Instagram and Facebook pages. Thanks for listening to the Doc Dudes. This is Dr. Garrett Harper along with
Dr. Evan Zug.
See you later.